There are specific nutritional aspects in the preconception period which are of importance for both maternal and fetal health. In particular, folate supply is essential to support healthy fetal development. Folates comprise a group of substances that belong to the B vitamins. Folate is also known as vitamin B9. It is essential for numerous body functions. The human body, for example, needs folate to synthesize, repair, and methylate DNA. Folate is especially important in aiding rapid cell division and growth, particularly during pregnancy and during early childhood. Children and adults require folate to produce healthy red blood cells and to prevent anemia. Humans cannot synthesize folates within their body. Therefore, folates are essential nutrients that have to be supplied through the diet on a regular basis to meet the body's requirements. Folic acid is the synthetic form of folate, and it is found in supplements and in fortified foods. Natural folate is rather unstable, and quite a bit of contents in food are lost during cooking and food preparation. Also, natural folates have a low bioavailability. Only about 50% or half of the natural folates consumed from foods are actually absorbed and taken up into the body. In contrast, the synthetic form, folic acid, is rather stable and almost the entire intake is absorbed into the body. In order to account for these differences in stability and bioavailability, dietary intake of folate is described using a dietary folate equivalent, or DFE. 1 microgram of DFE is equal to 1 microgram of food folate, or half a microgram of folic acid if taken on an empty stomach, or 0.6 microgram of folic acid if supplied with meals. In 2015, the World Health Organization established population-specific cutoff values for red blood cell folate concentration to determine adequate folate status in women of reproductive age. The aim was to effectively prevent the occurrence of neural tube defects in population. On a population level, red blood cell folate levels in women of reproductive age should be above 906 nanomole per liter to achieve an optimal reduction in neural tube defects or NTDs. There is no established serum folate threshold for pregnant women, and the red blood cell threshold only applies to determine population folate status, but not the individual risk. The amount of folate-rich food required per day to meet the requirements is so great that where possible, the WHO, as well as a majority of international recommendations, stipulate folic acid supplementation in addition to a folate-rich diet. Folate and folic acid derive their names from the Latin word folium, which means leaf. Folates occur naturally in many foods and are especially plentiful in dark green leafy vegetables, in legumes, citrus fruits and juices. Folates are also common in breads and cereals that contain flour enriched with folic acid. Folate is required for cell division and it plays a major role in the prevention of NTDs. NTDs are serious congenital malformations that result from failure of the neural tube to close during early embryogenesis between 18 and 26 days after conception. It is therefore paramount that an adequate amount of folic acid is already consumed prior to conception to achieve adequate tissue concentrations at the very beginning of pregnancy. The timely intake of folic acid supplementation before conception is emphasized by the number of unplanned pregnancies. In 2006, 49% of pregnancies in the US were reported to be unintended. Folic acid supplementation after the diagnosis of pregnancy is far less effective and usually too late to really effectively reduce the risk of NTDs because the closure of the neural tube is completed usually by the time when a woman starts to know that she's expecting a child.
The protective effect of folic acid in the prevention of neural tube defects is well proven and has been established by a number of randomized controlled trials. And a 2010 Cochrane review of folic acid in the preconception and early pregnancy period in the prevention of neural tube defects and other defects such as cleft palate concluded that the folic acid was beneficial without any evidence of harms for the mother and baby. And in fact, around 72% of neural tube defects could be prevented by folic acid during this time period, either alone or in combination with other vitamins and minerals. An excellent example of the benefits of folic acid fortification of flour comes from the United States. And here, folic acid fortification was first introduced in 1996, followed by mandatory fortification from 1998 with 140 micrograms of folic acid per 100 grams of flour. And immediately following this, the prevalence of neural tube defect births began to decline, and indeed folic acid fortification of flour is now estimated to prevent around 1,000 affected neural tube defect births annually. And this success has led to other countries globally introducing mandatory folic acid fortification. And 86 countries worldwide now have such legislation in place.
Because the increased needs in early pregnancy are very difficult to meet with dietary intake alone, the most widespread strategy used is a supplement of multivitamin preparation containing 400 to 800 microgram of folic acid, even in the case of fortified foods. Many national and international nutrient requirement setting bodies recommend an intake of 600 microgram per day of dietary folate during pregnancy. However, for the purpose of reducing the risk of NTDs, it is recommended that women, in addition to the dietary folate intake, also consume at least 400 microgram per day of folic acid in the form of a supplement or with fortified foods. This should be started at least 1 month prior to conception and continued until at least 12 weeks of pregnancy. After the 12th week of pregnancy, women should increase their folic acid supplement dosage to about 800 microgram per day. Globally, more and more guidelines are suggesting that not only pregnant women, but all women of reproductive age should take a daily folic acid supplement. This is an attempt to reduce the risk of neural tube defects in unplanned pregnancies as well as in planned pregnancies. For women with a history of children with neural tube defects, for women with diabetes, or for women who receive anticonvulsant treatment, as well as for obese women, the recommended dose is 4 to 5 milligrams of folic acid per day. High-risk women should consult a doctor to ensure the correct guidelines for folic acid supplementation are followed. Folic acid supplementation in the preconception period effectively reduces the risk of recurrent NTDs by about 70%. Therefore, its inclusion in preconception preparation, as well as for all women of childbearing age, should be considered an essential part of prenatal counseling.